The lack of communication and accountability from the police, paramedics, hospital and aged care facility to Robertson's family, who were not informed about the incident or the cause of her bruises. Norma Robertson was a 79-year-old woman with dementia who was living in a dementia unit at Hammond Care in Sydney. On June 4, 2020, she became agitated and paramedics were called to subdue her. They also called the police for assistance. Robertson was taken to Hornsby Hospital for assessment and returned to the care facility the next day. However, her family was not notified about any of this by any of the parties involved. They only found out when they visited her and saw her arms and legs covered in bruises. Some of the bruises appeared to show finger marks, suggesting she was handled roughly by the police or paramedics. The family was not given any explanation for what happened or why they were not informed. Robertson's daughter, Kirsty McGregor, said that after the incident, her mother did not sleep for months and became more distressed and confused. She said she was not blaming anyone for calling the emergency services, but she wanted more transparency and accountability from the police, paramedics, hospital and aged care facility. She also wanted more training for police on how to deal with dementia patients and more consultation with and notification to the family before using law enforcement. Robertson's case is not an isolated one. There have been other incidents of police using excessive force on elderly dementia patients in aged care homes, such as tasering a 95-year-old woman in Cooma and handcuffing an 81-year-old woman in Randwick. These incidents have sparked outrage and calls for reform from advocates, experts and families. The police have defended their actions as necessary and proportionate, but have also launched investigations into some of the cases. The aged care sector has also acknowledged the challenges of managing behavioral and psychological symptoms of dementia and has called for more funding and support from the government. The lack of communication and accountability from the police, paramedics, hospital and aged care facility to Robertson's family shows a systemic failure to respect the rights and dignity of dementia patients and their families. It also exposes the gaps and weaknesses in the current system of aged care regulation, oversight and quality standards. It is clear that more needs to be done to ensure that dementia patients are treated with care and compassion, not with violence and neglect.